Hi, this is Dr. Kevin Smith. Thank you very much for checking out this video on inflammation. In this video, we're going to cover three topics. We're going to cover what is inflammation. We're going to discuss the difference between acute versus chronic inflammation. And number three, we're going to discuss how inflammation is one of the common triggers that causes thyroid problems. Before I get into the information I want to talk about, I want to share a story about a patient that I have that I'm treating for thyroid problems. We'll call her Louise. That's not her real name, but we'll call her Louise. Louise is in her early 40s. She works at a retail store near the mall, and she's 40 hours a week plus, and she noticed that she started to feel a lot of aches and pains in her body. A lot of her joints hurt, her muscles were stiff. She started to feel some brain fog and had difficulty concentrating. She had low energy, lethargy. No matter how much she slept, she could go to bed at 8 o'clock at night, wake up at 7 in the morning, and she'd still feel tired throughout the day. And she started to notice that she was eventually experiencing a variety of low thyroid symptoms, such as weight gain, cold in her hands and feet, thinning and brittle hair, other types of thyroid symptoms. She got some blood work done, and the blood work showed a number of inflammatory markers in her labs, such as elevated C-reactive protein, elevated homocysteine levels, ferritin levels, and she also had an alarmingly low level of vitamin D. All of these are indications that she's experiencing a high level of chronic inflammation. Now, this is very common, and I want to discuss with you what inflammation is and explain the difference between acute versus a chronic inflammation. Inflammation is something that occurs naturally in the body during tissue damage. The tissue damage could be due to anything. It could be due to trauma, chemical problems, sunburn, toxins. There's a lot of different things that can cause inflammation. And what happens during inflammation is that the surrounding tissues around the damaged tissue start to secrete certain chemical substances to stimulate the initiation of the healing process. Some of these things include histamine, serotonin, bradykinin, substance P, and other types of chemical messengers. And the other thing that occurs during the inflammatory process is the four cardinal signs of inflammation. They're dolor, calor, tumor, and rubor. Rubor is redness, tumor is swelling, calor is heat, and dolor is pain. So those are the common signs that you see during the course of an inflammatory process. It has to be really underscored that the inflammatory process is really important for normal healing to occur during an acute traumatic tissue injury. However, this is going into the second part, chronic versus acute. You want some inflammation to occur during an acute injury because it sets the stage for healing. However, if you can't shut that process down, if that fire continues to burn out of control, you have chronic inflammation. Chronic inflammation is not okay, and it is actually linked to almost every disease that we know about. Heart disease, cancer, diabetes, autoimmune disease, and yes, thyroid problems. So moving on to the third point, chronic inflammation is a common trigger for thyroid problems, specifically low thyroid problems. And what's going on is that it affects not only the thyroid gland, as well as the receptor sites of every cell that receives the thyroid hormone. But chronic inflammation also can disrupt all of the peripheral organs and systems that are involved in normal thyroid metabolism, including the brain. And if you recall from my other videos, the thyroid pathway involves the hypothalamus and the pituitary, both of which are structures in the brain. So chronic inflammation can affect the CNS. It can affect the liver, which can disrupt the conversion, a process of T4 to T3. Chronic inflammation can affect the gastrointestinal system, which can further affect the conversion process. It can affect the immune system, and immune markers are intimately involved with thyroid metabolism, especially during the process of Hashimoto's autoimmune disease. So chronic inflammation is one of the cardinal disruptors of thyroid physiology. It is one of the triggers that can be the root cause of why you suffer with low thyroid symptoms or hyperthyroid symptoms. Okay, so in summary, what we covered in this video is we talked about what inflammation is, we covered acute versus chronic, why acute is okay, chronic is not okay to have, and we discussed that chronic inflammation is a trigger for thyroid problems. This is Dr. Kevin Smith. Thank you very much for checking out this video. If you have any questions, please feel free to visit my website, integratedmetabolic.com. If you like what you're seeing, I'd encourage you to please subscribe to my YouTube channel and please tell a friend. Thank you very much for checking out this video.